So I want to do something kind of fun, and I have a few rapid fire questions called myth or fact.
Okay.
So you tell me if it's a myth or a fact, okay?
I will try to get this right.
The first one, myth or fact, the results of liposuction will appear instantly.
Myth. And it takes a while, right? So patients, I warn them that they often come in looking worse the day after surgery because when you have surgery, the result is swelling, right?
Yes.
The same way, people say, what's swelling mean? Why do you get surgery? So if you've ever burnt yourself baking or reaching into an oven or a grill, and you see that little blister that shows up within 30 seconds, it's filled with fluid.
Yeah.
That same process happens in your body, right? So people will come in and 24 hours later, they'll be more swollen than they were on the table and say, oh, that doesn't look as pretty as it did yesterday. And we expect that, we know it. So the key is really to prepare patients so their expectations are set the right way. We tend to get really excited about how patients look at that 3 and 6 month check. So there is an evolution. So we do a lot of hand holding. So knowing that patients are going to go through this sort of delayed gratification, seeing that, we have them come in at one day, mostly to see if they're feeling okay. Is their pain well controlled? Then we'll have them come in a week and take out some of the sutures. Then we do 1, 3, and 6 month checks because we're making sure that they're on track, hitting the marks as we expect. But I always tell patients the visit we're looking forward to, where we photograph them and say, hey, can we put you on the internet because you're a great example of how good somebody can look, it's usually that 6 month check.
Well, that's good to know. So people can, not panic if the day after surgery.
Well, yeah. So the key is to set them up ahead of time to say, you're going to be swollen. You're not going to see a result for a while. So there is no panicking as long as you prepare your patients the right way. Yeah.
So, and then myth or fact, compression garments can help improve the results of liposuction.
I would put that into the fact category.
Okay.
I think it's something that most of our surgeons do. What it really does, it helps to drive out some of that swelling that we've just been talking about. So you're driving fluid out, you're getting closer to that permanent result a little bit faster. And I think that there's people who believe, and I don't know that there's great literature to support this, but there's some people who believe that compression ultimately might lead to a better result than if you don't use compression at all. I think if we ask that question to 100 surgeons, you'd probably get a whole variety of answers to it.
Interesting.
And patients certainly don't love their garments, especially in the summer. But patients will absolutely see unequivocally if they wear their garment for 6 days and take it off for 48 hours, they notice how much more full they look, and that makes them anxious. So it unequivocally makes them look better in that early phase where they're swelling. And that helps them be happy with their result faster.
Yeah, of course. And then the last one, myth or fact, that liposuction is only for patients under 40.
Myth. And, it really comes down to patient selection more than age. Age is a factor, and certainly a 40-year-old is going to have different skin quality than a 20-year-old, and an 80-year-old is going to have very different skin quality than a 40-year-old. As long as the areas have good skin quality and the patient's healthy, you can often find a liposuction plan that's going to help somebody achieve their goal.
Well, thank you so much, Dr. West. This has been so informative.
Absolutely. It's been fun being here.
Yeah, thank you. Thanks for watching. All of our featured care experts recommend and accept the CareCredit credit card, which is accepted at hundreds of thousands of provider locations nationwide. For more information, visit carecredit.com.